This patient came to see me 4 years ago. And here's the date, as you can see. 4 years ago for endodontic treatment of tooth number 14. Dentist was cleaning out the decay when pulp was exposed. That's the temporary filling in the tooth. So pulp exposure, irreversible pulpitis. So we went ahead and started and completed the endodontic treatment in one appointment. And take a look. This was immediately after we did the root canal. And this was one of those teeth that didn't have an MB2. And that happens rarely. With these teeth, they usually have an MB2, almost always. But in this case, this tooth did not have an MB2. This was immediately after we did the root canal. And here's the date, as you can see, 2020, 7/9/2020, 4 years ago. Patient came in today so we can look at a different tooth. And we always look at the teeth that we worked on before. And here's the tooth today. Tooth has a crown on it right now. And take a look. 4 years post-op of tooth number 14. And here is the date. As you can see, today. 4 years post-op of tooth number 14. Patient is asymptomatic. Tooth is in full function, has a crown on it now, and is doing beautifully. 4 years post-op of tooth number 14. This is another angulation. Another angulation. Another angulation. Excellent.